Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Orlistat. Its brand name is Xenical. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Orlistat is a reversible inhibitor of intestinal lipases. It makes lipases unable to hydrolyze triglycerides into absorbable fatty acids. Because undigested triglycerides are not being absorbed, this can create a calorie deficit and have positive outcomes with weight control. In terms of indications for use, Orlistat is indicated to be used in the treatment of obesity. Now, before somebody was to use Orlistat, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Orlistat or any other component of the product, they would not be able to use this medication. This medication also cannot be used by patients who have chronic malabsorption syndrome. This medication also cannot be used in patients who have cholestasis or in patients who are pregnant. Now, in terms of precautions, it should be noted that this medication may cause a reduction in absorption of cyclosporin, so that medication should be separated from Orlistat by about 3 hours. The weight loss that may occur may affect metabolic control, so some patients who have diabetes may have to take lower doses of their hypoglycemic medications. Substantial weight loss may increase the risk of cholestasis. There will be an increased risk of gastrointestinal events or side effects if the medication is administered with a high-fat meal. It should be noted that severe liver injury has sometimes been reported with the use of Orlistat. And there may be a reduction in absorption of fat-soluble vitamins. Sometimes patients use a vitamin supplement to help with this. If they do, they should separate the dose by 2 hours from Orlistat. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Orlistat, they can expect to receive their dose orally as it is available as a capsule. So if somebody is using this medication in the treatment of obesity, they would typically use 120 milligrams about 3 times daily during or within 1 hour of receiving a fatty meal. The over-the-counter dose would be 60 milligrams taken 3 times daily, and they would follow that same rule of using it during or within 1 hour of a fat-containing meal. As with all medications, there are some side effects or adverse reactions that patients may experience while using Orlistat, so we'll go over some of those here now. Up to 41% of patients may experience abdominal discomfort or abdominal pain. About 1/3 of patients may experience defecation urgency. Up to 12% of patients may experience an oily discharge from the anus. Some patients may experience flatulence or an increased frequency of defecation. A backache may happen in about 14% of patients. And about 10% may experience pain in a lower limb. 30% may experience a headache, and up to 40% may experience influenza. About 25 to 38% of patients may experience an upper respiratory tract infection. Now, some more rare but serious side effects would be liver failure or nephropathy. That's all we're going to talk about today with Orlistat or Xenical. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.